Hello everyone and Jai Jinendra. I welcome you all on this webinar. Before we start this webinar, I request Mr. Akaji to start the prayer with Naukar Mantra. Thank you, Akaji. Proceeding further, I request Sri Raviji Jain, Director in charge, JPF, to welcome all.
Jai Jinendra and good evening to everyone who are attending this webinar. I welcome the office bearer from JITO Apex, JITO Bangalore, JITO Pune and JITO Nashik Chapter. I am thankful to CA Dr. Sanjay Burad ji, Dr. Yogesh Kothari ji, Dr. Ajay Kothari ji and Dr. Manoj Chopra ji for making this event happen. I am also thankful to Milind ji and Satish Parekh ji for their great support to JPF always. I am delighted to welcome Dr. Milind Antani and Dr. Sushil Jain ji as key speaker in today's webinar. JPF has successfully organized several online events in recent months and many more are lined up in the coming days. I request all the professionals who are present here to please come forward and join the JPF platform. I am sure this webinar is going to be very informative. So, no delaying anymore. I request Dr. Atul ji to take the charge and proceed with the webinar.
Thank you, Raviji. Thank you, Raviji. JITO Professional Forum have gained popularity with its quality content in such a short time. We have Sri Ajay Bora, a mind behind this platform. I request him to share the insight about JPF.
Thank you, both of you. Well, JITO Professional Forum is a vertical of JITO, which consists of the professionals and gets operated by the professionals. Members of JPF includes doctors, lawyers, architects, banking and financial services professionals, chartered accountants, salaried executives, and consulting engineers. Well, in today's era, GST, tax compliances, expediting payments from the health insurance companies, accessing debt or equity for growth, artificial intelligence in healthcare, architectural design and government approvals, medico-legal issues for hospitals. These are some of the areas where the need for the doctors to network with other fellow professionals from different segments can be quite high. JITO Professional Forum represents such platform where professionals can connect with fellow professionals from different occupations and also with the business community at large to create a collaborative advantage, which is so critical to survive and thrive during these uncertain times that we live in today. We appeal to all Jain doctors and JITO Professional Forum attendees to be a part of this platform for unlearning and relearning. Today's session is one such example where the legal fraternity and healthcare fraternities intersect and both can add value to one another, which is medico-legal / telemedicine. With that, over to you, Dr. Atulji.
Yes.
Welcome, Satishji. He has just joined in, Satishji Parak, the ex-chief secretary of JITO Apex and also the current member of the board of JITO. Over to you, Dr. Atulji.
Yes, thank you, Ajayji. Now I request CA Dr. Sanjay Burad to give program background speech.
Today's speaker, Dr. Milind Antani, special invitee Dr. Sushil Jain, dignitaries, all doctors and participants. Good evening and Jai Jinendra. JPF has successfully organized webinar on finance and legal matters, and we thought the next logical extension of this knowledge sharing platform will be to have a webinar for the real warriors of the current days, the doctors. I thank Raviji and Ajayji for their wholehearted support throughout the process. We at JPF decided to take webinar on the latest subject, telemedicine. Government has issued extensive guidelines for this. Dr. Milind Antani has gracefully accepted our request to guide the doctor's paternity on this subject. Thank you, Dr. Milindji, for your kindness. There cannot be a better name for a talk on this subject other than Dr. Milind Antani, as before entering the legal profession, he has practiced 15 years as a medical surgeon doctor. Bangalore, Pune, Nashik Chapter, JITO Chapter Chairman and Secretary have supported for the organize this event. Convener Dr. Yogesh Kothari, Dr. Ajay Kothari, Dr. Manoj Chopra and Dr. Atul Jain have performed their responsibility with utmost sincerity. Many doctors from Pan India help us to reach you. On request, Nirmal Kotecha, President of JITO Professional Forum, has agreed to become our knowledge partner. Thank you, TPF. Milind Bhai Shah, General Secretary JITO, requested Dr. Sushil Jain from Washington DC to make a special comment today. Apart from being a great leader, we have experienced Dr. Jain's humble hospitality when we had attended G2G program in San Francisco. Author James Clear, in his book Atomic Habits, has stated that start with some small beginning whereby you will reach your bigger target. This is a small beginning in JPF for doctors. We request all doctors to join JITO Professional Forum. Telemedicine is an order of the day. Dr. Milind Antani's experience and knowledge will enlighten all the doctors on this subject. Thank you. Over to Ajayji, Dr. Atulji.
Thank you, Sanjayji. Now moving towards the main event, I request Dr. Ajay Kothari, JPF Convener Pune, to introduce Dr. Sushil Jain. Sushil Jain, sorry.
Thank you. It's my august duty to introduce Dr. Sushil Jain from USA. So Dr. Sushil Jain is a past president of JINA. Now what is this JINA? So JINA is Federation of Jain Associations in North America. And he's been a past president of JINA. Now, when we talk about Dr. Sushil Jain, so basically he is an optometric physician. He is into private practice, and one feather in his cap is he was the former consultant to White House and the US Capitol and an assistant professor. So I think this has been an incredible achievement, Dr. Sushil Jain. His education is, he is BSc with MS and FAO. All of his graduation and post-graduation has been done in USA. When we have to share his accomplishments, so he was the first vice president of JINA from 2011 to 13. He was the convener of 2011 JINA convention. The most important part is he was very key in clearing the law HR 5202, which was plan-based health school lunch program in partnership with PCRM. He was instrumental in inclusion of Tirthankar Mahavir Nirvan Divas in President Obama's Diwali speech. He has arranged legislative conference on non-violence in partnership with American Jain Commission and NAACP. He has organized and led medical mission in partnership with Sean Penn's organization to assist in Haiti. I think his list of achievements is endless. Means when I had asked for his CV, I got some 4-5 pages full of his CV. So cutting long story short, Dr. Sushil Jain is a very prominent practitioner in USA, and with the advancing trends of teleconsultation, it's an honor to have Dr. Sushil Jain on our webinar today, and he would throw an important light onto this topic. I would not come in between you and Dr. Sushil Jain, and handing over the next proceedings to Dr. Sushil Jain. Thank you so much.
Thank you. Thank you, everyone. Good morning from US and of course, good afternoon or good evening in India. One important part of my background is that I was also in the US Navy for 26 years. And one of my duties, along with taking care of being a CEO of a command, a hospital command, was also the medical logistics and doing the medical intelligence analysis for the White House and the US Capitol for presidential travels and briefings. So with that and a lot of other military obligations, achievements, accomplishments, I want to focus on our today's conversation where we had a firsthand experience, especially the medicine, the way we practice today versus what we have been practicing in United States Armed Forces is pretty much consistent. As you know, the pandemics have been coming to us from as old as the time of Moses, as well as from Harappa, Mohenjo-daro. So having pandemic is really nothing new to our civilization. It's just that in our lifetime, this is the first pandemic that we're facing. And I do realize that I'm talking to a group of physicians predominantly. So I'll kind of steer, I made notes just to make sure that I stay on time of 10, 15 minutes. So I'll try to summarize what we have done and grown, especially in last 3 months, and then in preparation for what the armed forces have been doing. And I don't mean just the US Armed Forces, I'm talking about the global armed forces, each unit. The telemedicine is nothing new to the Department of Defense of every country. What the civilians are now doing is we have shifted in the United States, and we done that in 19. We had no idea when the first pandemic occurred in our lifetime in the early 1900s, is that the awareness have become so media explosive that it's now becoming the world issue and becoming a world global solution as well. As you know, during these times, we have seen hospitals that are being built on the parks, hotels are being converted into hospital ICU beds, and you see the dormitories as well as the gymnasiums and convention centers are now converted into inpatient units, even to provide the advanced life support. We have seen that the preparation and the importance of masks, the PPEs, the hand sanitizers industry has grown multifold from a 600 billion industry to a 60 billion industry in next couple of years. Most dramatically, sorry. So the most dramatic caregivers have routinely become the only people who can hold. During this pandemic, we have found that the people who are providing care are the only and the last people that the people have had to say goodbye to. And that's especially to a dying patients. My son and my daughter-in-law are now living in Bronx and they're physicians. This is just a little personal story. And I do remember in March, they had to drop off their daughter to us in midway between New York and Washington. And they had to say goodbye to her with the intention and the fear that they'll never see us again, because of the Bronx was one of the concentrated area of where the pandemic occurred. What they were seeing is that they were experiencing more death just before as the patients are rolled in. Oftentimes they had to make a very tough decision. By the way, my daughter-in-law is a pediatrician, hospitalist, and son is a pain management doctor. So they're pulled away from their primary duty to provide the advanced level care. We had dentists, they had dentists providing ICU care. And especially the CCUs and all that. It was just total chaos. And I'm talking about the first 2 weeks of March, 2-3 weeks in March. They had no proper PPEs, no proper masks. And you know the rest of the story. They signed more death certificates, holding hands with the people who were taking their last breath than they have ever done in their entire career. And this is coming from all the doctors. So the pandemic, especially in New York area, was so dramatic that it's traumatized our family from the point where we would be surprised if we saw them or heard from them in the end of the day. Anyway, I'll come back to that. So this is what we have faced, and I don't think India has faced to that situation where doctors, we are the last one to hold their hands, and no family members is allowed. Looking at once at these kind of crisis, one of the challenges that we found is that the world is learning for solutions. The intelligence and the amount of intelligence and the analysis alerted or should have alerted our leaders to be prepared. We didn't have the infrastructure, but had these intelligence gathering been occurred and allowed and paid attention seriously, we could have controlled it much better. I mean, today, as you know, we have 2.5 million cases in USA and 125 to 130,000 dead. And with Dr. Tony Fauci, who also happens to be my personal friend, they said, Sushil, if we were to just do this in January or February, do all the preventive measures, we could have globally prevented or at least had somewhat of a control. Now, what this pandemic has done in support of the telemedicine, in the military, we have been practicing telemedicine ever since the space age. When our submarines are at 10,000 depth, or there are 10, 15,000 feet in the air, or in the spacewalk, we have had communication through the radio waves or the other frequencies. So we've been talking and giving medical advices to the independent duty technicians or our technicians or physician assistants in our case, or nurse practitioners that are on board. So that has been around since early 60s. And when we started to send people on the moon, you know, we had the telemedicine, a reformed type of telemedicine. And today with telemedicine, we can do everything. What are some of the laws that have changed? You know, as you said, the conversation about the legality and the completeness of telemedicine. Recently, the CMS, the American Medicare system and all that, actually the reimbursement from a third-party insurance is now considered higher or equivalent to being reimbursement for being the in-hospital and in-office care. So that's a big positive change. Similarly, the acceptance of physician extenders is also now equivalent and also are provided more independent than before, simply because the doctors and physicians can only do telemedicine and, I mean, you know, can only consult and keep up with the needs of it. In last 3 months, we paid so much focus on the COVID type of incidents and really put away our routine care aside, because the mind change of the patients is, I have to go see in the office. Until the doctor actually touches me or just listen to my lungs and do some of these things, it's considered incomplete. Well, that mindset is really changing very dramatically. And the patients are doing more and more, are welcoming the telemedicine to provide the care. I do as an ophthalmology consultant, my wife does it. We sit right here on this desk and see our patients at least twice a day. And I mean, sorry, twice a week. And the other days we see emergencies where we actually have to go see them. In support of what Milind ji and Ajay ji said, we do go ahead and order based on what we see the preliminary symptoms. We go ahead and order whatever labs, x-rays, MRIs that we need, so that when we sit down with the patients, we can go over it on the patient's computer as well as our computer. One of the challenges that we face here is, of course, the Wi-Fi connectivity, the internet connectivity, internet strength. That has been our challenge, and we're moving forward with that. Physician extenders for expansion here in USA, in the remote areas, we're looking at a concept of training the least trained to provide the first level of care or first level of diagnosis. Do you really, and majority of the people, just like everywhere else in the world, are focused at, do I have COVID? That's what they were. As soon as they sneeze, they think, okay, I got COVID and I need a test. Unlike other countries, many of the areas are providing this test for free. Here, there is a charge of $89 to $90, which are also picked up by the third-party insurance. That was at one point, it was a debate who should pay for it. But the CMS and the third-party insurance decided that they will go ahead and cover that expenses. Now, moving forward about where we are going, is the artificial intelligence. I was in Bangalore at the professional JVN network, and we talked about what are some of the emerging market that we need to be looking at. And this is what we in USA are paying attention to and moving very forward, especially in preparation for 2001 and realigning our vision from the White House and the WHO. Heavily relying on artificial intelligence and virtual reality type of work. As you know, the artificial intelligence has done a 40% growth in last 2-3 years, since 2014. So any companies that are providing, they've appreciated that level of attention. And artificial virtual has really helped us quite a bit in prepare for the future in terms of marketing, appointment reminders, even checking to see if the patients are taking medicine on time, how much, are they delayed by 2 hours, 3 hours, by simply putting in a little device in their medicine cups or the organizers. The telemedicine and artificial intelligence also identify people of high risk, discovering those needs of medical intervention earlier. So that all does. Voice searches. One of the medical intelligence gathering that we do is how many Google hits do we have from one particular zip code or one area. And that's how the Chinese, and this is what we were doing as part of the analysis, is during this pandemic that was occurring, the amount of the searches, the search engines, the hospital parking lots, the type of appointments and the symptoms that people are researching provides in medical intelligence for us to see, okay, what's going on, because the government are very notorious about not telling these things in its true sense. Then we would look at the actual travel pattern of the patients from their area, and that's our predictor. Some of the things, so we talked about the voice searches. Voice searches tells us in one particular zone, for example, if it's Bangalore or right here in Washington, in Fairfax, if there's a lot of people that are looking at symptoms for self-diagnosis, the government or the analysts saying, wait a minute, why is there so many searches that are going on this particular topic? And chat box about the chat is becoming a new way of care. The top, let me just, I know I'm running out of time. So let's go into some of the things that we are preparing, and this COVID situation has helped us move it and shift it into a faster speed. These are top technology that are gaining a lot of attention here globally, is of course the smart inhalers. The smart inhalers, as most of you all know, is going to be more of a refresher for you, is the smart inhaler for that, for asthma control or asthma delivery system. You know, 94-95% of the patients are really, especially the elderly, are not taking that spray appropriately. So the device implanted into the inhaler, number one, reminder, as well as it actually measures the effectiveness of this, the inhaler. Second, there is a nanotechnology at NIH being developed. How can we deliver other drugs in an inhaler format, being an aerosol case? The next, of course, the robotic surgery. Needless to say that we have moved our smaller incisions are helping with the recovery as well as the cost. 3D printing is helping us quite a bit with the becoming one of the hottest technology in the market. And these printers can be used to create an implant and even joints to be used during the surgery. Prosthetics are being developed. And again, these are a lot of bioproducts that are being used for that. Artificial organs are being developed through the bioproducts. And of course, the wearable health devices. Coming from, again, this is the space technology that has moved from what our astronauts used to use back in early mid-70s or late 70s, is now being put on a wristwatch where we can actually monitor EKG, we can do labs, we can do the implants under the skin to monitor any activities. So that technology is growing more and more, and during these times, there's more of this being practiced and prescribed. We're able to tell our patients that go ahead and get that watch so I can monitor your EKG. using the even the smartphone, a very simple device that can, and the app can do a lot of these devices. We can do urinalysis. Urinalysis was only just to do the UBNs and things, but now we can do a lot more just by looking at a drop of blood can do a lot of things for us. As you know, precision medicines about delivery, exact drug delivery system. You can read the same thing on that. Virtual reality, as you know, you can put a tablet in or monitor through the injection. You can actually go through the actual body and actually get a diagnosis. So that's gaining a lot of momentum. Coming back to, of course, the telehealth in next few years, we're looking at as many as 60% of customers are now going to digitally led services. We're looking at which describes quickly developing technology. This will be a quickly that will allow the patients to get care digitally instead of waiting for face-to-face appointments. That's started to occur. Highly personalized mobile apps are being developed, which allow medical professionals to receive instant diagnosis from the labs directly into our cell phones. Lab results, X-rays, MRI results can be on, and we can access it from our smartphone no matter where we are. And concierge care is gaining very momentum. Concierge care, of course, those that are impaneled into just to you, that's gaining momentum. And now in last 60 days, we have seen more patients enrolled into concierge care, where you have one provider who is aware of the entire one person or one family's health needs. And that has helped us quite a bit. And the last I quickly touch on is, of course, the advanced gene editing technology. And that has helped us quite a bit and moving in the right direction, where in terms of editing the genes for diabetes, so you can eliminate in some of these inherited conditions. These have a lot of recruiting potentials for knowing what gene is. By gene editing, we can reduce some of the chronic care and heritage cares inherited. Again, the dramatic movement that we're seeing, again, in the interest of time, I didn't want to go into in-depth, but coming back to the telemedicine with third-party insurance now being covered, the adjustment, what we see in the future in the next 12 months when the CDC and our Medicare and payment, and most people, the most insurance companies do follow our Medicare reimbursement system. The RVU-based relative value unit reimbursements are expected to adjust because there is going to be a less need for my nurse. Because if I'm doing a telehealth, sure, vitals, I can get it from patient's cell phone or devices. I can see them, so then I don't, the government saying that I don't need as many nurses to do the pre-op or pre-preparation. Government is saying I may not need a 5,000 square foot office space. I should be able to do with 1,000. So the care reimbursement for in-office, we expect that to be readjusted. And telemedicine, as an encouragement to telemedicine, they will increase the reimbursements for telemedicine and do more of a preventive care and more frequently. We project the telemedicine, our average patient visit per year for our senior population, these are Medicare, which are 64 and 65, is a 4 primary care visits per year. We expect that primary care health to go, visits to go into 6, but we'll eventually adjust that by supporting more and more data. So, and this is what we have been doing in the armed forces. We prefer to just pick up a phone call and answer patient signs and symptoms. So it's kind of like promoting more and more of prepaid care and balance that with the telemedicine. So I'm sure there are lots of questions, and I'll be glad to take it at the end or at the later time. So again, I apologize if I've gone over my time. I'm sorry, this is usually a 1-hour discussion with Q&A, but apologize for going over.
Thank you, Dr. Sushil Ji. Now is the time for we were waiting, or I request Dr. Yogesh Kothari, JPF convener, Bangalore, to introduce Dr. Milind Antani. Dr. Yogesh.
Hello. Hello.
So we can hear you. Please go ahead.
Sir, thank you, Sushil Ji. It was wonderful knowing the insights of the future. It is my privilege and honor to introduce the speaker of the day today, Mr. Milind Antani, Dr. Milind Antani. He was a ENT surgeon, and he was practicing in Anand. And from a practice where all of us are into practice, suddenly he had a moment, and from that moment he thought, he wants to diverse into a different, totally different yardstick and a totally different profession. And he practiced legal, became a lawyer, and then joined Nishith Desai Associates, and he is now a lead in the Nishith Desai Associates, especially in the social sector practice and the pharma healthcare practice. He's multi-skilled, as we all know, a person who was a successful doctor suddenly taking a fresh challenge on himself and becoming a successful lawyer. So definitely challenges is part of life, and he loves them, I'm sure. And he represents many high net worth clients in matters of joint ventures, mergers, and acquisitions. He looks at VC funding, private equity investments, and various other collaborations, both on the private sector and on the government sector. And he's been on the board of various government sectors also. And he is taking a very, very prominent role in the digital health, which is the emerging thing today. And if you look at digital health, it is the way it is expanding into all our practice with this limitation of the COVID. I think we all need a lot of understanding and the legalities. And I don't think we can get a better person than Milind Antani. And Dr. Milind Antani, I would like to welcome you to give us what we need to know as our practitioners in this teleconsultation, and what are the new laws that have changed in these recent 3 months, so that our practice in telemedicine becomes much more easier and our legalities reduce. Thank you, and over to you, Milind Antani ji.
Thank you. Thank you so much. How much time I have? Because I just wanted to know that.
We have 40 minutes.
Already 6:30. Is okay, 40 minutes?
Yes.
Yeah.
Okay, fine. I'll just share my screen. Good evening, everybody. I think, very rightly pointed out about everybody and Dr. Sushil ji also, that yes, we are into new normal. And, when I speak, you're going to hear a lawyer in me, you're going to hear Dr. me also. But now this new normal that has really happened, and it is said that whenever there is a crisis, it brings a lot of opportunities. And should I call emergence of telemedicine, which was already there, even in India also it was there, but very badly regulated or very poorly regulated, or whatever you call it. It has come with a lot of opportunities, for sure, for a medical profession, but there are so many challenges. The best thing that really happened was a new guideline that came before 25th of March of this year, 2020. Telemedicine was not at all regulated. There were so many regulations which was governing, which are still governing, but there was no clarity. In fact, I am a member of Telemedicine Society of India, and I have drafted the Future Telemedicine Act of India, which is submitted along with Telemedicine Society of India to Niti Aayog, which may become law. But before that, because of the urgent need, I think this telemedicine practice guideline was notified in 2020 on 25th of March. But I think, the point is, you have no choice. You will have to embrace it. But the problem is, I'm using the word problem, being a doctor, that compliance is going to become very important. That's why I thought, let me just talk about compliance more. But before we move on to telemedicine, I will just spend half a minute on digital health, because telemedicine is a part of digital health, and Dr. Sushil has rightly explained to us. So there are so many things which are there, right from health service aggregation to self-monitoring devices, e-pharmacies, mobile data, big data in healthcare, robotics, AI and machine learning coming very soon. Rather, already there are a few companies in India working on that. E-learning has become huge. Now it is going to become very important. I'm going to touch upon that. And the telemedicine is one of the most important part of the digital health that I think we are going to discuss. Now, what exactly the telemedicine is? And I'm consciously going to try to avoid as many legal jargons as possible, so that I don't forget that I'm a doctor, and doctors usually don't like the dotted lines. But whether you love law or hate law, you just can't ignore law, and that's what I think I'm going to tell you. Now, broadly speaking, in fact, telemedicine also has been officially defined now, and I've just taken the important parts that it is just the use of telecommunication or information communication technology to provide healthcare, whether it is a teleconsult, whether it is teleradiology. But the challenge, why telemedicine really picked up, is first of all, doctors started getting calls in some form that I need some treatment, but I can't come to hospital. So doctor also could not go to hospital, and because patients were not going, maybe out of fear, maybe out of compulsion, maybe they were in containment zone. Uh, at the same time, patients also wanted to access to get some guidance. And as very rightly mentioned earlier, that WhatsApp was a big challenge. WhatsApp is still a big challenge, but to some extent it has been taken care of. So to avoid this, government came out with some very interesting thing. Now, what are the forms? What we are seeing today? We have seen everything, but what I think we are going to discuss more today is teleconsult. When a doctor talks to a patient, what exactly happens, what can be done, what should not be done, that we will quickly touch upon. Now, what are the key elements? Telemedicine per se is going beyond doctor. Remember, there are very important key elements. I picked up few important things. In the entire telemedicine process, you could have primary doctor, you could have an expert doctor, and there is a patient. These are the human angle or the human element. But another most important part you need to be aware, that we will discuss later on, being a doctor who is providing teleconsult, that there is an entire telemedicine system. There is a platform. Sushil talked about the biggest challenge of internet bandwidth and other things. But at the same time, it is not there at the moment. But very soon you are going to see companies coming out having a telemedicine center, so it becomes the first interface with the patient and the second interface of the patient. You may have telemedicine center A and B, and that is beyond law, but that you need to be very watchful while rendering your teleconsultation services from law point of view. And another thing is, it is very important to understand the basics from telemedicine. I'm going slightly on the basics to understand more how exactly law will go. There is important part is consent. You know, in a medical profession, the consent is the most important thing. And 14 years, I had a printed consent form which I used to modify depending upon the surgery. And one fine day after I became lawyer, I realized it was all nonsense. I'm sorry to use certain words. But consent is important. But in telemedicine place, consent is going to play a huge role. Another important thing is medical records. Under Medical Council Act or Medical Council Code of Ethics, we are supposed to maintain the records of patient for a stipulated time. But when you are doing teleconsult, that doesn't mean you are not supposed to do. You have to also take care of records, especially from liability point of view, legality point of view. It is going to be very important that you take care. But the biggest challenge on medical record is going to be the data, because you are going to sit on the data, which is called medical records. And in our legal language, we call it sensitive data and personal information. And under today, we have a data privacy law, which is a data privacy rules under Information Technology Act, where I don't want to go much into, but most important point there is that without the proper express consent of the patient or the person who gives you medical records, which is SDPI, cannot be shared with third party in an electronic form. Now in telemedicine, everything is going to become electronic form. So you have to be very judicious on taking consent. And two most important point I want to touch upon on standards is the technology. Though you are not going to manage technology, I was talking to one group of doctors and I curiously asked that how many of you are independent and how many of you are working with or providing teleconsult with third-party service providers. And almost 85 to 90% were third-party service providers. So you are dependent on technology. It could be technology of the technology service provider. If your hospital where you are working, a corporate hospital or a bigger hospital, then that hospital would have telemedicine center or their own technology platform. You may be visiting doctor or you may be full-time employee. So purely from liability point of view, technology is going to play a huge role. And the last important point which we are going to discuss is professional negligence or the errors. Providing teleconsultation or telemedicine platform does not absolve you from any kind of liability. So whatever you are possible to go through in case of professional negligence or an error or the negligence, what patient can do offline, patient has the equal rights to do to you even though you are doing a telemedicine. That is why I think government came out with telemedicine practice guidelines. Medical Council of India has gone, so there is a board of governors which has superseded the MCI. So they came out with, in association with the telemedicine practice guidelines, excellent document. Of course, it's a dynamic document. It is going to change regularly. So there are lots of concerns today, especially the oncology practice is facing significant problem because practically they cannot advise anything considering certain exclusions. But this telemedicine guidelines has become an absolute mandatory thing that it has allowed all the registered medical practitioners, allopaths, I'm talking about allopaths at the moment, to practice telemedicine. Before this, it was not possible. You may not be knowing that if a doctor sitting in Hubli is advising a patient sitting in Mumbai, Karnataka Medical Council would not allow him to do so under law. Whether you are doing it or not is a different thing, but you need to take a permission from the Karnataka Medical Council as well as Maharashtra Medical Council to do so. There was a huge issue. I was one of the most important person who advocated on national telemedicine practice license. But through these guidelines, I think government has allowed you to practice across the country, except one thing that you cannot provide under this guideline, international consultation. Now, I'll quickly take you through what exactly guidelines say. As I mentioned, you can practice across the country, no interference from the local state medical council. However, these practice guidelines do not give you permission to do overseas consultation, or rather, from law point of view, I won't say that you cannot practice, but these guidelines do not cover your consultation with overseas patient. Earlier, it was very important to comply with the prescription. I'm going purely by the law. I don't want to go by how exactly things happen. It was very difficult to give prescriptions on online. Just taking a picture of your prescription with your signature and sending it on a cross was illegal. Sending email of your prescription was not as per the recommendations under various acts. Another important thing, but in these guidelines, they've allowed e-prescriptions and they've given some formats also, as long as it is in consonance with the prevailing law. One important thing I think entire doctor fraternity needs to know is on the prescription and what can be prescribed. This telemedicine guideline has given 4 lists: list A, list B, list O, and prohibited list. Like for example, you cannot give narcotic drugs, etc. There are some issues on oncology products. But depending upon the type of consult, you have to prescribe any product from list A, list B, or list O. Another important thing is how exactly you can go ahead. How can you provide service through third party? But end of the day, guidelines is ultimately it is the doctor's discretion that is going to decide. But the most important point, and that is very important to understand for you, that whenever you find that there is a possible emergency, there's a very thin line. It's a very thin line, and that is where the doctor's discretion is going to play a huge role here. That whenever you feel that there is a possibility of emergency, you have to direct that patient to a nearest hospital of a, like for example, while we were talking and there was an example given that a patient on teleconsult came with a left shoulder pain, and with the doctor's discretion and his knowledge and his experience, he told him that let us first rule out cardiac problem, and he was referred to the next hospital to go under EKG and turned out to be acute MI. So this is what I think the best thing that can happen. But never try to treat, you cannot, not never try, you cannot treat emergencies over telemedicine platform. And apart from that, telemedicine guideline also has certain exclusions, which I'm going to quickly, but important point, it is notified, and on 12th of May, these telemedicine practice guidelines have been included officially under MCI Code of Ethics, which is the professional misconduct guideline you have, in which it has been officially included. So any non-compliance with telemedicine practice guideline, Medical Council of India or the Board of Governors, which has superseded, would have a right to take action. However, there is no clarity what type of action, which type of action, but possibly they will go by what used to happen with Medical Council of India. But another important thing, that telemedicine practice guideline, now I've started talking law, has specifically mentioned about all applicable relevant laws of treating patient while practicing teleconsultation or telemedicine would be applicable. Good part that has happened is recently IRDA, which is the insurance authority, through a notification, I think 10-15 days ago, have notified that all the reimbursements, claims of patients arising out of telemedicine practice would be sanctioned or granted. So telemedicine practice is a part of insurance claims, which is a very positive thing that has happened. But remember that all prevailing laws are applicable. So my one request is that whenever you have time, please go through this telemedicine practice guideline. I will send it to Sanjay, and you can circulate and you can just go through. It's a very long document, but pick up what really matters you the most. I will quickly go to exclusions. And these exclusions, I will touch upon quickly what exactly the exclusions are. But now I want to touch upon, so this is not how telemedicine really came out. And that is where I think how to manage it, being a doctor. And that's why I'm reminded of my father, who used to tell me that, Milind, you need to know two things. That Ramayana has taught you what to do in life, and Mahabharata has taught you what not to do in life. And this is what I think every doctor has to understand. Of course, I do believe that Ramayana did tell us what not to do and Mahabharata did tell us what to do. But broadly, this is what I remember my dad telling me years ago, that this is how you have to decide, because end of the day, it's your discretion which is going to bring you out of any legal tangle or liability arising out of that. Now, what should be the way forward? A simple advice. Please understand few things. One, what are the exclusions in the telemedicine practice guidelines? Second, what are the applicable regulations and the compliance required? The need for documentation, the contractual relationship with collaborating partner. This is going to be rampant. I'm using the word because I've seen so many doctors associating with so many third-party service providers. Managing data is going to be huge. New laws are coming very soon. And of course, potential liabilities due to negligence, you need to understand. I'm not frightening here. I think nothing can happen to a doctor unless there is a gross mistake. Now, what are the exclusions? Now, these guidelines have excluded specifications for hardware, software, infrastructure, building, or maintenance. So this guideline does not cover, does not guide, does not bind any of these service providers like computers or your infrastructure of internet bandwidth. Is not governed by this. It only governs the act of a doctor. Data management services involve standards and interoperability. Another important thing, it excludes how data is going to be managed. Third is use of digital technology to conduct surgical or invasive procedures remotely. If any procedures are happening through digital technology, it will not be governed by these medical guidelines. Other aspects of, like for example, if you use telehealth for research, evaluation, or you're using it for education of healthcare workers, again is excluded. As I mentioned, it has excluded your consultation with patients outside India. And the most important thing that is going to become a challenge is they also exclude all the technology platforms on new tech, which could be AI, machine learning, nanotechnology, or it could be augmented reality or virtual reality or 3D printing. Whatever is coming are all excluded. So why I'm spending some time on exclusion is that because if something goes wrong, where any of these 6 points which I have mentioned, telemedicine practice guidelines which has certain defenses for the doctor would not be handy. That is what I think you need to understand. Again, it is not at all that difficult. Second, let us understand what are the applicable laws or regulations for telemedicine and what compliance is required. First, most important, I'm going in a reverse direction, is Information Technology Act. Why it is important today? You are going to manage data, healthcare data. India does not have any law like HIPAA, which is in US. There was one law called DISHA, which was Digital Information Security in Healthcare Act coming. But because General Data Privacy Law is coming soon, I was a core committee member who drafted DISHA, but that has been shelved because bigger act is coming. Now, this Information Technology Act, as I mentioned, has data privacy rules, where so many things are there, what should be done, what should not be done. But most important thing is, unless you have obtained consent of the patient to share his or her information to third party in electronic form. So whenever you obtain patient's consent, like my brother is a doctor in Anand, I have so many friends in Anand. I've already told them that whenever you are taking consent, please add one line and take permission of the client to share data, because you might be taking second opinion. You might be taking second opinion, or for that matter, physician or an orthopedic surgeon seeing the patient and refers that patient's data or records to radiologist for CT, MRI, or just simple X-ray without the consent of patient may become a non-compliance with data privacy rules as of today. Now, new law is coming, so we have to comply with the data privacy. We'll discuss that. OSP regulations is not applicable at the moment to you. MCI Code of Ethics, which is now, of course, though Medical Council of India is replaced by National Medical Commission, but MCI Code of Ethics is absolutely applicable, and that is where they have also included the telemedicine practice guideline. So any non-compliance with MCI Code of Ethics would also be called non-compliance. Pharmacy practice regulations, of course, if you have your own pharmacy in your nursing home and you are looking at supplying medications online form, prescriptions is allowed, but how you are transferring those medications to that patient, there are certain regulations there. We'll quickly discuss. Indian Medical Council Act, we have discussed. Drugs and Cosmetics Act is a primary act which governs pharma primarily, not the doctors. But it has certain schedules on advertisements. But most important thing is it has provisions about how prescription should be. Telemedicine practice guideline has allowed electronic prescription, which was not allowed earlier. But Drugs and Cosmetic Act has given certain guidelines what prescription should be. So see that you are complying with in fact, this telemedicine practice guideline has given a model prescription based on the Drugs and Cosmetics Act, but there are certain basic things, your name, address, diagnosis, your registration number, and proper instructions should be there. I don't want to go much into that. These are broadly the regulations. Now, the most important thing is documentation. I am talking about general records. Don't miss informed consent. There is again a provision for informed consent that you have to talk to the patient, explain patient about the limitations of telemedicine, that it is not the complete guidance, there is no physical examination happening. So there would be some kind of restrictions on giving your diagnosis. So you have to explain everything to the patient. And also it says that you must see complete records of the patients before you start consultation. Those who are tied up with various organizations or various service providers, they give you complete data of the patient before consult. That's a good thing. But you must have informed consents. Whatever telemedicine interaction happens, please maintain logs. It could be recording of interactions after informing patient. Patient also has a right to record the entire conversation, but they should take your permission. Or you can just have phone logs, or you can write down. You can write down on a piece of paper. You can take screenshots of chats because guidelines have allowed social media. They've allowed WhatsApp chats and all other chat rooms while giving consultation, which was not allowed. But maintaining all these records and documentation is going to be very important. It is very important to also take control of all the records. See all the records before you give consultation. Just don't click the chat button or voice button or a video call or an audio call and start talking. Before talking, please see the patient's records, all the documents. Patient might be coming as usual, talking to a few more doctors and coming to you. You may be the 4th or 5th or 3rd or maybe 10th doctor. Test results also need to be obtained. You please see, and whenever you advise any test result, it should be very specific and what should be done. Prescriptions I just told. But what I'm trying to say, whatever advice you give, you must document. Whatever reports they have shown you must record. And why logs are important? Because it mentions time, at what time you have talked to the patient. This is about documentation. I would spend some time on contractual relationship here because you are going to work in multiple forms. That is what I have understood. One, you can be working independent. You are a techno-savvy doctor. You have a greatest bandwidth and you have all possible setup on your laptop or your phone, and you know how to handle it, and you straight away talk to your patients and finish it off. Second is there would be third-party service providers, where I don't know, there are so many service providers, you know more than me. They would have approached you. Various models are there, fee sharing model, revenue sharing model. I don't want to go into that, but it's a legitimate service providers. They help you. But so there is going to be one contractual. Second is going to be, if you're working in a hospital in some form, you could be an employee or you could be a consultant. It's a different ball game, but it is going to be a contractual relationship with you are collaborating with hospital. And lastly, telemedicine service centers would start coming very slow and very fast. They may hire you as a visiting consultant or an advisor, or they may hire you full-time to help them. But most important point I want to bring here is that do not ignore proper documentation. You need to have a kind of a master service agreement or whatever service agreement you call it, even if it is with hospitals. If you are a consultant, you might be working on a simple piece of paper that we hereby happy to invite you to be a visiting doctor on Monday, Wednesday, Friday, and operate at your convenient time when OT is free. Or you could be a full-time employee, there could be employment agreement. But see that the reference to telemedicine or digital health consultation is included through amendment, because that will come to your defense and help if some error happens, maybe because of the technology service provider, maybe because of the hospital where you are operating or where you are rendering services, or a telemedicine service center, something goes wrong in the infrastructure. So most important clauses you must know is what are the roles and responsibilities of you as well as the third party provider or the hospital or the telemedicine service center. Second important point is indemnification. Indemnification is something, you have medical indemnity insurance. That is from where the word indemnity has come. that either you should indemnify the service provider or hospital, but I'm talking about you, that you must in that contract have a clause in which either third-party service provider or the hospital or the telemedicine service center indemnifies you. That means they give you protection against any claims arising out of fault of their infrastructure, fault of their service, or whatever it is. Why? Patient is going to take action against you. Patient knows doctor. Then onus would be on you to understand what was the problem and pass on the burden of proof, as we call it in law, to third-party service provider or the hospital or the center. But that is where this documentation is going to be very helpful. What are the obligations? Is hospital obligated to provide required bandwidth? Because if there is a poor bandwidth, there is a disturbance, and you say you gave some advice and patient understood it wrong, and there is some morbidity or maybe mortality happening, could be a problem. And representations and warranties are very important for you being a doctor, that when you are entering into a third-party service provider mainly, please ask for all the requisite permissions, approvals, setup, which they have adequate and to the utmost quality and requirement to enroll you as a doctor in the platform. This is most important thing, and if they write in that, it is confirmed that they have it, even if they don't have it, and obligations of all the parties. So please give importance to, I know 15 years as a surgeon, I hated signing on the dotted line. I hated reading, and don't depend on lawyers. I'm telling you for this. It is a very simple thing, no rocket science, no difficult language. Just see that there is a proper documentation in place so that will help you as a defense if at all some liability comes. Now, data. Most important thing is you have to save and store all the data, which I've covered everything, but do not ignore to take permission, consent of the patient in any form, because you are going to transmit patient's record in electronic form for sure. Again, as I mentioned, if you are working with third-party service provider, you have to check that where they are going to store data. Are they storing as per the regulations or not? This should be good enough for you. But apart from data privacy laws, which I mentioned, I'm repeating again that please do not forget to record document all the logs and consultations and prescriptions, because they will be very handy if situations come. Now I'll go on to in next 10-15 minutes quickly on potential liabilities and negligence. Now what liabilities can happen? As I mentioned, telemedicine does not absolve you from any kind of action that can be taken against any doctor in case of medical negligence. One, of course, let us go general, is a non-compliance with the guidelines. If you are doing any non-compliance with the guideline, if you are supposed to prescribe from list A, but you are prescribed from list O and patient suffers from something, there is a possibility of your practicing license in jeopardy. Like for example, there is something called follow-up consultation. Remember that follow-up consultation under telemedicine is only physical consultation. If patient comes again on teleconsult, it remains the primary consultation, and that is where you can prescribe drugs which are mentioned in the list A only. So please read again guideline. Another is the breach of data privacy. Breach of data privacy would be at present under data privacy rules under Information Technology Act. When patient feels that my data, my privacy or my data has been disclosed without my consent to third party, or maybe a third party service provider uses that data for some other purpose, and patient has a right to take action against you under Information Technology Act, and after some time we have a general data privacy law coming under that. Contractual liability, I mentioned that if there is a breach of contract, you are supposed to the obligations and rules and responsibilities which you are supposed to follow does not happen, then the opposite party, either hospital or a telemedicine service center or a third-party service provider, can take action under contractual liability. I'm not going to much into that. I've discussed on that, but let us quickly touch upon medical negligence. Where it can happen? The medical negligence can happen when there is some kind of error happening over telemedicine. I'm repeating, I'm talking only telemedicine. So don't think that I'm talking about error during operating, error during procedure, error during examination. At the moment, I'm talking only on telemedicine, but there is a possibility of medical negligence happening. And once again, I'm repeating that when it comes to any liability on part of doctor arising out of medical negligence while performing teleconsult or telemedicine services, all the laws that are applicable in India would be applicable. Telemedicine guideline, which has allowed you to do telemedicine, would not help you. That is why when I say prevention is better than cure, it is no rocket science. There is nothing that can happen, but we just be careful. Now, what exactly medical negligence? Let me give you something. What exactly the medical negligence is? Let me tell you, for medical negligence, doctor can be sued under criminal negligence or a civil negligence. Two different things. But I tell you, don't worry, don't panic. It is said that for any negligence or a medical negligence to be considered as a medical negligence, the degree of negligence should be very, very high. It could be gross or very high degree, that intentional cutting of internal carotid artery or puncturing superior vena cava or puncturing intentional puncturing of lungs and a lot of other things from criminal point of view. And there is something called mens rea. Mens rea means intention to do harm. That there was an intention on part of doctor to do harm to the patient. So it was an intentional thing. But usually what we have seen purely from the medical negligence point of view, unless it is proved, see, it is said that unless proved, everybody is not guilty. The same principle applies in medical negligence also. But depending upon the type of negligence that can happen. Now think, what type of negligence can happen on telehealth? You are not operating, you are not examination. So major possibility of immediate injury to anatomical body part or something is not. What I see being a doctor, of course, 16 years I am nailed by knife, but what I understand is it could be either a wrong instruction or a wrong diagnosis or improper information. Now, this cannot happen only because of you. This can happen because of a lot of other things. Low bandwidth, other infrastructure issues, patient not very clear. And that is why, again, I'm coming back that having logs and having documentation is going to play a huge role. So don't be afraid of significant liability that is coming out. If you are very overconfident and aggressive in treating emergency patients, and if it is proved that sorry.
Dr. Antani, this is Ajay. If you can just take 1 minute of your time. Sorry to interrupt.
Sure.
So the doctors are suggesting they have some questions. So if we maybe
I'll just finish off 2 minutes. Give me 2 minutes.
And I'll then we can move to the Q&A session. Yeah, sure. Thank you, Doctor.
Okay, so these are the laws which are applicable. There are various case laws. I don't want you to go into it. But quickly, let me quickly spend only 3-4 minutes on these 3 minutes. These are the best practices which will help you defend yourself. Consultation, do your consultation to the best judgment. You are the person who decides where to stop. Your consultation should be limited to first aid or a life-saving measure or a counseling or advice on referral that please go to other place. It should never be anonymous. Don't treat any patient whose identity you do not know. Your credentials must be declared to the patient. Patient has a right. Always ask patient's age, because do not consult minor over telehealth without major. Always obtain explicit consent if you have started consultation. But if patient has started consultation, then it can be implied. Always record the consent in some form. It could be email save, it could be screenshot or whatever it is. Follow the guidelines of prescriptions which is mentioned in the guideline as well as X, but it is a must that appropriate diagnosis or a provisional diagnosis is mentioned when you are transmitting prescription, subject to your prescribing the drug in the list and no overseas consultation. Purely from mitigating liability quickly, 1 minute. Identification of a doctor and patient, as I mentioned, is a must. Always inform patient about all the potential risks, consequences, and benefits that can happen. Do not handle emergencies. Recording of patient's satisfaction if he wants. Proper documentation of everything and confirming proper contracts. So I'll just end with only one statement, that the professional judgment of a registered medical practitioner should be the guiding principle for all telemedicine consultations. Great things have happened. I'm telling you, there is no way you should not go ahead. It is going to be the new norm. But and a lot of positive things. And again, this telemedicine practice guideline is a dynamic document. It is going to change possibly every 3 months, 6 months when we are in tune of it. And do practice, do understand, do read. A lot of positives have come. So I'll just end by only my favorite statement, that at the end of the tunnel, always there is a light, which is positive. End of the tunnel, always there is a light, but be careful. It could be of a coming vehicle. So practice telemedicine guidelines properly, but always watch out. Thank you very much. Over to questions.
Thank you, Dr. Antani. Now, Dr. Atulji.
Yes, sir.
Yeah.
Excellent, sir. Thank you. Now, this is the question answer session. I request Dr. Manoj C. Chopra, convener JPF Nashik, and Dr. Kamlesh Nahar, convener JPF Chennai, to conduct question answer session.
And Dr. Kamlesh is also representing the Therapan Professional Association. Over to you, sir, both of you.
Yes.
Dr. Chopra, to you also. Both of you can unmute yourself.
Unmute, yeah. Can you hear me?
Yeah.
I can hear you.
Yeah.
Yeah, Dr. Kamlesh. Yeah, basically, first, Dr. Sushil and Dr. Milind, I think they have given a very good and broader outlook about the telemedicine to us very well. So, first to Dr. Milind, as you said, talked about the telemedicine, their legal applications, and the doctor role is very important. Now, I want to ask you that about the video consultation and non-video consultation, what are the precautions we should take? Because when we are doing a teleconsultation or a WhatsApp consultation, many times it's a text or you're just sending a message. And the prescription, if you want to give it in a first consult, what precautions doctor should take?
Okay. We are talking only teleconsultation, is that right? So when you are doing your teleconsult for the first time, so under new guideline it is called first consult. It is defined, the guideline. And for first consult, I think prescription is not a problem. That is number one. But the 2 or 3 precautions I mentioned here. One is that you cannot prescribe medicine beyond list 8, which is their telemedicine practice guidelines. That is number one. Number 2, the prescription which you are sending, either video consult, will end of the day, if you do audio consult or video consult, when you are sending prescription, it has to go through some form. It could be email, it could be PDF on WhatsApp or whatever other media you want. But that prescription should be the typical prescription which you use. Name of the patient, provisional, final diagnosis, registration number, etc. Take a picture, it could be JPEG, it could be PDF, but it should be transmitted to that patient. So this is broadly about prescription. Again, I repeat, the most important point, if it is a just first consult, and as I said, that follow-up consult happens only under law when you are examining the patient physically. So till then, you can prescribe medications which are mentioned in list A. Okay. Now, what are the prescription? What are the precautions? First of all, as I mentioned, whether it is audio or video does not mention. Non-legal, to avoid any problem, please be brief, be very clear, and use short sentences. That would be very helpful in future. That is number one. Number two, do not go overboard on diagnosing from whatever information you have. If you think additional information is required, you may advise properly on audio or video to get that test done. But I personally advise, write it down on a piece of paper on your letterhead, take a picture and send that advice. Please get this test done and we will do consult tomorrow, day after, whatever time that suits. This is when you are doing directly. The same principle happens when you are working with third party. You have so many, you have M-Fines, Spectos and Librates and so many. There are plenty of them now. So there also principles remain same. But there, most important point, please you see that the bandwidth. Because many times we have seen that the bandwidth that is available may be not as required. In fact, there is a recommendation of 50 Mbps speed under law, which I think is going to be taken care of because everybody may not have that bandwidth. But the third party service provider information that service provider gives you of the patient before you consult, please see them properly and disclose everything. And the last and most important, explain everything to the patient and take the identity of the patient. This is broadly.
Yeah, that means doctor's role is very important in deciding should we continue the teleconsultation or not, and the what
your discretion. Your discretion.
Yeah, and what accuracy of information is getting, and he needs any other information or not is very important. Or he can decide that ask patient to send the other information by mail, then recheck it, and then do give a proper advice. Otherwise,
it could be by email or even WhatsApp. Even WhatsApp,
whatever.
All social. Now, earlier, honestly speaking, nothing was allowed.
Yes,
so everybody was doing is a different thing.
Yes. I said in initial my comments that the WhatsApp advice was there and patient landed within a court and doctor was he was fine.
Even there is a case law called Pavaskar couple of Aurangabad.
Yes.
Fortunately, it was taken care of in Supreme Court. But you have to be very careful on what you are talking on your phone. Right. So only thing is don't overboard. That is what my one word advice.
And why this about there is a query now. When we write a prescription, then always you should sign it and scan copy. We should send it, or how it is to be done.
Prescription without your signature, whether it is
not valid.
Earlier it was digital signature on the prescription, but now under new law, any prescription without doctor's signature, same doctor's signature, please.
Yes.
Your assistant doctor signing your prescription on your letterhead can put you in deep trouble.
Yes.
So any prescription without signature of doctor is a simple paper. It has no value. But good part is you sign it, write it in a legitimate, legible, clean handwriting, or it could be print out from your computer, sign it. You can scan it, or just take a picture on your phone.
Letterhead.
Letterhead prescription. See that it is a letterhead. Writing on a piece of paper would not work.
It's letterhead is important.
Letterhead is important. It should have your registration number. That is another important thing. So typical prescription, what you write, take a picture, take a JPEG, and straight away send it to WhatsApp or anything. It's fine.
Yeah. Dr. Kamlesh Nahar from Chennai, will you ask the question? Dr. Kamlesh.
Yeah. Congratulations, Dr. Milind, for a very comprehensive, detailed, informative coverage of this new tool to us. My one question is, now this is open to all the registered medical practitioners of India, and the spectrum is from a general practitioner to a super specialty consultant. So in practice, the vigilance and precautions of both vary. So is there any guidelines you would like to give that what kind of platform to be chosen or which service providers to be chosen by which category of consultation? Or some basic things, precautionary things are there which could help them to choose
Sure.
which way. Yeah.
See, I think, again, depends on the location. That is number one. There are so many service providers. I don't want to mention any of them purely from country point of view. Some of them might be my clients also. But what you need to understand first is that is where roles, responsibilities, and representations and warranties that pick up why, and it's a very important question you have asked me, sir, that when you are going to practice telemedicine with third-party service provider, choose well-established, number one, which has a proper technology and excellent bandwidth and support. These are the three most important criteria. Because of the telemedicine guidelines which allowed telemedicine for every allopathic doctor, right from PSC to the nearest possible hospital, pardon my language, but so many telemedicine service providers have mushroomed suddenly. You will see there were only 10, 15, but now we have 1,500 possibly in India. So work with well-established service providers, you know all of them, number one. Number two, proper technology they have. And the third and most important thing, who agree to your terms. That is very important. I'm not going into the profit sharing or fee sharing. That is a commercial call. But if they refuse to sign on indemnification clause, if they refuse to sign on representation and warranty that they have all the rights, they have all the approvals, they have all the licenses to practice whatever they are doing, and they do not agree to the certain obligations which I discussed, do not work with them. Simple. This is a broad advice I thought I'll give you.
One more, my concern is we all have been trained in the way of physical clinical examination, and there is one very basic apprehension for everybody whether he should join up this telemedicine or anything. Now, the way patient tells their symptom or they convey us, sometimes they say it in their own way, but during examination we do find out what is the real thing. Is it our binding that now that these conditions, when we come back to a normal situation, once we come back to something like normal situation like earlier one, should all these patients whom we have consulted, are there any binding that let's call them back and then do a physical thing and what are, because this gives a gap of some mistakes or some findings to be missed. So anything kind of that?
Yeah, so I think, okay, another very interesting and good and practical question. Nowhere there is a law that any patient who has come on telemedicine or teleconsult to you must be examined physically in future. Patient may become all right on your teleconsult. It's a simple thing, It's a ENT surgeon. It's a common cold and gives few medications, and patient becomes all right. Patient may forget the doctor. But to answer your question, when things become normal or things may not become normal, honestly speaking, and even if things become normal, telemedicine is not going to go. Telemedicine is going to grow huge. But it is not mandatory under law to call all those patients who are seen on teleconsult must be examined physically, okay, under law. But if you feel that this patient is consulting me, he has consulted me 10 times on teleconsult, okay, अरे सर ये अच्छा हुआ लेकिन ये नहीं अभी अच्छा हुआ है, okay, ये अच्छा हुआ तो अभी सर में थोड़ा दर्द है, or general thing, because what I see initially or a once you may feel that everybody has become GP. Let me tell you, initially that feeling may come. Once you go second consult or third consult, then I think you will enter into your speciality or expertise. Or what I am seeing, I'm hearing from my brother and my friends in Gujarat that all their chronic patients have gone on telehealth. All the chronic patients, the diabetic patients or your post-operative patients who have like major surgeries done. So all the relatives are there coming and taking advice that what to do, how to go ahead. These are the problems. So all those morbidities can be taken care of over teleconsult. But unless and until you yourself feel that I need to examine this patient, call that patient. Otherwise, law does not mandate that people have to come when things become normal. If somebody is very comfortable, like you are sitting in Chennai and I am your patient in Mumbai, and I am so happy with you, I'll keep on consultation over telemedicine for 10 years. I'm fine. There is no need, even everything will become normal. I love you. I have amazing faith in you. So it happens. How that stops you.
Yeah. There is
Yes,
Dr.
Dr.
Mahendra
Manan.
Bafna. You wanted to ask something. Dr. Bafna, Pune. Okay, I think he's not eligible. Basically, you talked about one is a documentation.
Yes.
Right. Basically, what I feel many times that the patient of diabetes, hypertension, or patients who are on a chronically following with us, where angioplasty has been done or bypass has been done, and there we feel that these patients can be managed very well in the follow-ups on the teleconsultation. So there, this examination part, what Dr. Kamlesh talked about, that is not required much, and the follow-ups can be done easily. Or second opinion means specialist to specialist consultation, that can be teleradiology, teleophthalmology, or echo or angiography pictures also. So how do you think that the where should we fit it into teleconsultation, and is there any care needs to be taken?
So to continue the patient on teleconsult is your own discretion from your knowledge, your skill, etc. And you know the patient. So law does not say that you must. But whenever any information or reports or any instructions from documentation point of view, please record all that in some form. It could be a log written that I sent so and so on so and so date to this patient, because I personally feel a patient doing a lot of teleconsult on follow-up may become slightly confident or may become overconfident that I'm totally fine, doctor feels I'm totally well. But when to call them if you think is not required at all, but whatever instruction, advice or reports you share, or you may be sending some literature also, record everything in some form. It could be simple log, take screenshots, or if it is chats, take screenshots of the chats, keep it with you. If at all something goes wrong, and patient may say, hey, if you had called me personally to examine, I would not have suffered from this. That situation may come at that time. So this is what the things, it was all properly done, but it could be a problem that developed before last consult and as of today.
ओके डॉक्टर मिलिंद जी, एक सिनेरियो है, जैसे मैं मेरे गांव में हूँ, मेरा पेशेंट है, हेलो या मैं मेरे गांव में हूँ, मेरा पेशेंट है, उसको ठीक किया और कुछ थोड़ा ठीक हुआ, कुछ और चीज नहीं आ गई, ही कैन कम बैक एंड अप्रोच मी, मेरे को पकड़ ही लेगा कहीं ना कहीं घर पे क्लिनिक पे। पर ऐसा है कि इसमें दूसरे शहर से पेशेंट है, आई हैव ट्रीटेड इट, लिटिल बेटर है, पर कोई दूसरी चीज है और कोई कारण से ही इज नॉट एबल टू अप्रोच मी, इट कुड बी ऑन हिज साइड और डॉक्टर साइड, वॉट एवर इट इज, मतलब डॉक्टर को अप्रोच कर रहा है, डॉक्टर अप्रोचेबल नहीं है या अवॉइड भी कर रहा है, वॉट एवर सिनेरियो। तो ये इस सिनेरियो में क्या लायबिलिटी हो जाती है कि वंस यू हैव कंसल्टेड हिम एंड समथिंग हैज come up because of that consultation and then reconsultation is not being done, are not possible, are not happening. What do you advise?
Okay, let me tell you, there are certain patient has a lot of rights, but doctors also remember has a right to refuse patient. Let me tell you. Okay, but you need to have a valid reason. Of course, in
Yes,
emergency you cannot do, but the scenario which you just mentioned, कि एक बार आया दूसरी बार नहीं आ सकता. If you have a valid reason, whether you were not there or you were managing something else, and if you have a valid reason for not being approachable, no liability can happen to you.
Okay.
Dr. Yogesh Kothari. Dr. Yogesh. Dr. Yogesh, you have one question?
Yeah, hello. Can you hear me?
Yes.
Yeah.
One question I had is if the patient is on the list O of medicines and I am consulting him on follow-up, can I ask him to continue that or I cannot continue on telemedicine?
If your discretion says, see, again, follow-up, don't use the word follow-up from telemedicine practice guideline. The follow-up is in-person examination under guideline. But if patient is on list O medications, which is according to the topmost list, let me put it that way. Okay. If you feel that patient requires the same, you can ask him to continue. Subject to your discretions, you must have enough substantial information with you that he requires the same medications further. Should be fine.
Other thing is, I think Dr. Sunil Bora has a question. So somebody can unmute Dr. Sunil Bora. And regarding the consent, sir, I had a question on consent.
Yes.
So in the consent, should every time the patient books a teleconsultation appointment, should they, the third-party service provider take a consent from them, or how is that work?
If you are working with third-party service provider, and that is where again the contract with third-party service provider would come, honestly speaking, is that many a times, usually the third-party service provider tells you that I will do everything what is required before patient comes to you. All the examination, all the reports, as well as consent. So he takes it. Sometimes I've seen, because I have drafted certain contracts for third-party service providers on telemedicine. Sometimes they just want to give all the responsibilities on the patient, on the doctor, sorry. So at that time you have to do, but it is advisable, and what I know of most of the third-party service providers, they obtain fresh consent for every fresh consent. Even though it is a second teleconsult, everybody takes second consult, because what happens sometimes when they come online, there is something called terms of use and consent, which is, we call it a click wrap agreement, CLICK-WRAP. Whenever you press I agree, that is under law considered to be an agreement, like you must have booked your tickets, whether it is a cinema, whether it is your flight. Whenever you click on I agree, that means you have signed that contract, which you have not read, unfortunately. So that is where I think patient always agrees on terms of use or agrees on consent with third-party service provider. If it is not happening, I personally suggest that every consult, there has to be a fresh consent for that consult.
Yeah, Dr. Chopra ji, is it okay if I just take 1 minute? Yeah, just one request, Dr. Antani ji. There are a lot of questions on chat, so would it be okay that we can move up to for the vote of thanks now? However, if you have time available, there are a lot of questions on chat though. So after the formal vote of thanks, if it is okay with you, then maybe we can move on to the questions. A lot of valid, relevant, and quite interesting questions are there for you.
15-20 minutes more, no problem.
Sure. Dr. Atul Jain, over to you.
Yes. I would like to request Dr. Mahendra Bafna, convener Pune JPF, to convey vote of thanks. Dr. Mahendra Bafna, unmute please. No voice.
Hello.
Yeah.
Hello.
Doctor,
I think Mahendra, you have one question.
Mahendra ji, we can hear you. Please go ahead. He's a cardiothoracic surgeon from Pune. Dr. Mahendra ji, please go ahead.
Yeah, can you hear me?
Yes.
Yes, sir. Yeah.
Yeah, good evening, friends. It's my privilege to propose a vote of thanks on this occasion. On behalf of Bangalore, Pune, and Nashik, JITO, and JPF chapter, I would like to thank you all and all my colleagues who have directly and indirectly contributed to this webinar. I thank Mr. Sushil Jain from USA, who had given valuable inputs and enlightened us all regarding the recent developments in medical diagnosis and happenings in North America. I thank Dr. Milind Antani from Mumbai, an ENT consultant doctor turned lawyer and entrepreneur. We are blessed by his presence. He has given his valuable time of his busy schedule. He told us in a very simple and lucid way how knowledge of legalities in telemedicine and its applications are need of the hour. I must mention our deep sense of appreciation. I thank JITO Secretary Milind Shah, who was instrumental for getting Dr. Sushil Jain from USA and Dr. Atul Jain, convener JPF Health, in organizing this program. I thank all the doctors who attended this webinar, without whom this program would not have been successful. I thank you, thank the entire team in organizing this webinar. Thank you.
Yeah. Thank you, Dr. Bafna. Now over to you. Now before, sir, thank you, Dr. Bafna. Now before, we move on to question and answer as in an informal way, since the honorable speaker is here. Dr. Sushil Ji, are you there? And
yes,
Dr.
I'm here.
Antani Ji, just one thought came to our mind is that, JITO Professional Forum has been adding value. So one part is that on the US side, there is lot of regulation, and also the enabling legislations are in place, guidelines are in place. And Dr. Antani knows what are the gaps in India in terms of making telemedicine more effective. So would it make sense, this question is to Dr. Antani and Dr. Sushil Jain together, that maybe if we can exchange notes, and on JITO Professional Forum platform, maybe we can create a document and pass it on to, and maybe go together and present it to certain policymakers, whether it's Ayushman Bharat or at the Ministry of Health, because we do have some access there as a platform. So that what it can do is, we can really add value in terms of giving them that this is the context, this has been happening successfully in the US or other parts of the world, and these are the gaps or the loopholes or the enablers which are missing to make sure that we can really leverage the potential of telemedicine.
Sure, we can do that.
Absolutely. Yeah,
Yeah,
absolutely. Being a former commanding officer where we actually saw 5,000 to 6,000 patients per day in our hospital, I've seen any and every cases that as a potential liabilities, the ethical issues, et cetera, everything comes up. And it all points down to is the intention, as Dr. Antani said, it's the intentions of the patients and the doctor, and that relationship is the most key things that we have found in all the congressional investigations, the legal investigations, and it all boils down to the type of tests that are ordered, patient education, and establishing the patient's expectations, and documenting and making sure there is a follow-up care. Oftentimes in our practices, we get so busy that we don't take time to talk to the patients. Instead, and we in North America are especially guilty, that we'll go in and spend 10 minutes or hardly 3-4 minutes, because the way the system has worked is that we have our nurse or a technician to go in and explain their conditions and all that to the patient. Now, patients get very irritated because when they came into office, they actually expected the doctors to see them. And instead, because of the way the rules and regulations are, we are forcing the extended physician extender to use that. So that I would definitely look at that. The most recent, especially with the telemedicine, is the data privacy, as my colleague had mentioned. The data integrity and HIPAA violations are your #1 concern, because these data are being harvested for multiple purposes. #1 is, of course, the marketing. So that is #1 security that we have to be very cognizant of, to ensure that when our data or the patient data leaks, for whatever purposes, the responsibility of securing the data is on us and our management system. So I think just these 2 points. Otherwise, I think it was a fantastic, lots of question and answers. I am not an expert on US laws and the things, but I can definitely point out some of the potholes that we deal on a day-to-day basis in our current laser center.
Sure.
So
Thank you,
I'll be
Dr.
glad to
Sushil.
work with. Thank you.
That would
Thank
really
you.
help, because at least this could be a start of the collaboration between the two healthcare fraternities.
Oh, and by the way, the JITO USA, I happen to be the president of JITO USA. We have 3-4 chapters
Sure.
now, and more in progress. And most of them, by the way, are professionals, IT, lawyers, doctors, etc. So that's a big plug that we have to work. And what's missing here is our Australian partners, our European partners in this conference. And I think that will also add to these kind of seminars. So we would
Sure.
extend out our relationship.
Yeah, we look forward to working with you on that front, Doctor Sir. Thank you. Now, Dr.
Thank you.
Antani.
Thank you for allowing me.
Thank you, sir. Now, Dr. Antani, sir, there are a lot of questions in the chat. So if it is okay with you, maybe you can go ahead and answer those on chat, or you can answer them verbally, the way you prefer, sir. Are you able to see the chat on the...
Now, before that, I think let me add one thing. I thought somebody would ask me that question. That, any doctor who is going to, or who is, or who has started, or who will start telemedicine practice has to mandatorily undergo a training. That notification has come. But the timeline is, I think, 3 years. Within 2 years, or I need to just double check the notification. At present, NIMHANS is giving that training, is going to give that training. I'll find out that notification and circulate that to all of you. But it would be mandatory to get that training of telemedicine before, within a stipulated time when you started doing that. Okay, now if you want, I can start going. Wait.
Appeal to all the people who are still there online. You please be patient. Dr. Antani has been gracious enough to try and answer your questions on the chat. So please see your answer. Please look out for the answers on the chat. Dr. Antani, yes.
No, I will verbally. I won't type.
Okay, sure. Please go ahead. Yeah.
Give me a second.
And sir, if you don't mind reading the question also, so in the interest of the audience,
I will do that. Dr. Yogesh Kochari has written. Okay, one question. Okay, there is a question from Dr. Vijay Balgad. Is teleconsultation a totally voluntary, or can patient force you to give teleconsultation? No, it is totally voluntary. So no question about it. Then can you wait? I'm just okay. I will just hold mouse. Where can we find this list of medications? I think somebody has already circulated telemedicine guidelines India. Please download. It has all the informations. The recent change in USA, I think he has already answered that. A lot of questions are already covered. Can you give some examples of teleconsultation consult? Do we need to take consent even if the patient is accepted to teleconsult? Yes. So whenever, see, that is what I mentioned, that if you have initiated teleconsult, then there has to be an express consent to be taken by you. But if patient has initiated teleconsult, how the situations happen, because of these service providers, they do a lot of marketing, and they would just, the patient would just go to that platform, register themselves and become a registered user, go to somewhere and find out a doctor. You choose the patient chooses a doctor, and there he agrees on that, I agree, and click agreement. At that time, there is no need to take consent. The same continuation question is how to take consent. The same thing is that two ways of doing it. When you are doing it with third-party service provider, usually it would be taken care of by them. But if it is your individual consultation initiated by you, you have to create some kind of a mechanism, either send some document which they sign and then send it back. That is the express consent. That is usually going to be cumbersome, but we are expecting some changes coming there, that just accepting and returning that same form back would be considered as an implied consent. Please let us have phone number and email address. Milind.Antani@Nishith Desai. I'll type there. Give me a second.
Sir,
Huh?
sir, how to know about the bandwidth? You told that bandwidth of the third party, and how good is their data maintenance and security part of the third party?
That is why representation and warranty comes into picture. It would be very difficult. Usually what we have done and what we have seen, that you can ask the which the plan they are using, okay, and that has already, like for example, I am using Hathway and I am on a plan top which is 50 Mbps with 600 GB download, okay, so I have a 50 Mbps speed. But many, so you can ask for whatever, like for example, they would have asked for your registration certificate when you got enrolled with them. Same way you have to ask for, give me the details in writing, what connection you have, what is the capacity, and where exactly you store the data. So if this information comes in written form, and in the agreement, in the reps and warranties, you're right, that the service provider hereby represents and warrants that they have the best possible services and the data, store the data as per the applicable law. And suppose something goes wrong and they are not doing, then you can take action against them.
Sir, when we have a contract with the third party, should we have a hard copy of that one, or only the soft copy will do?
Hard copy, which is on 300 rupees stamp paper.
Okay.
Any agreement without stamp duty and in hard copy, then you may keep it PDF with you, but if it is not stamped properly, then it would not be a great document of defense in court of law in case of liability. Opposite parties lawyer may take that as a very negative point for you, and I have seen many examples where like for example, I was doing due diligence of one big hospital when one big investor was investing some huge money, and I found out that most of the documents were not stamped, and which became a huge concern, and they had to work on that, amend that, come on the stamp paper, and then deal happened. How to know the bandwidth? You asked me the question. What are the guidelines we should follow in case of second opinion, as it's mainly focused on deciding line of treatment and does not require to yes. So second opinion, so there are two types of models because there was no time I did not touch upon. So there are various models. One is a patient to doctor. Second is a primary doctor to secondary doctor. So that also becomes a all principles, all the guidelines which is applicable would be applied, because there you will be giving second opinion, what you are doing is right or what you are doing is wrong or what you are doing is not adequate. So either you will ask to change the treatment or you will add the treatment. So same principles, whatever you do over telemedicine platform to other doctor should be recorded, but it is allowed. Can I have your contact details, sir? Okay. If prior appointment given and due to some unavoidable reason doctor couldn't get teleconsultation, then patient can make legal complaints? No. They cannot. Because whenever it decides, it is decided, there also is returns. That is why the terms of use of third party are all become that in certain exceptional situation, doctor may not be available for the teleconsult and you will be taken care in the next list. Can you provide sample of consent form or telemedication? There is no typical sample, but telemedicine guideline has given 1 or 2 samples. But what it says that your prescription format given by medical council is good enough. I think questions, any questions I've forgotten? I see a lot of, give me a second. US. Is there a link where we can find the exhaustive guidelines? We are tech provider and developing a solution from Vaibhav to everyone. Now, go to just give a search telemedicine practice guideline in Google and you will get it. Somebody has already circulated PDF form. But once again, I tell you that tech providers and solution developers are excluded from the provisions of this guideline. What ideally you should go for is the data privacy laws and other things. Another important point, since I did not know that there would be tech provider here, that if you are developing any applications of telemedicine on Android or iOS or smartphone, it is important to take approval from Telecom Ministry, which is called OSP license, which is other service provider license, which is just an application and getting it, but it is mandatory. It will come in your way in future or something goes wrong. Now it says, so same is applicable for Mumbai, India. We are I don't know, this is from Oppo A9 2020.
I want to ask a question.
Sure.
Suppose I am using an electronic medical record software since last maybe 1 year. Initially, they did not have any teleconsultation facility, but after this pandemic happened, the teleconsultation has started in that. So I have not signed any document or anything for the teleconsultation. So should I review this document and then ask them to
with him is your old patient?
No, I am using a electronic medical record.
I know, but document with whom? Service provider you mean to say?
With the service provider.
Yeah, of course, it is a must.
Okay, because this teleconsultation was not included when
that is what I'm telling you. All documents where teleconsultation is not mentioned must be included. Period.
Okay. Okay. In the same thing, now since I have a lot of my patients on electronic record, and all of these are like regular chronic disease patients like diabetes, hypertension, IHD, gastric, whatever. So can we continue these patients on telemedicine? Because I know most of the patients. So is it required to take consent separately?
Preferred. See, honestly speaking, don't trust anybody.
Okay.
So because it is going, you have been doing it. There are so many patients, doctors doing teleconsultation years ago. Okay, a lot of people, and honestly speaking, I have done it 15 years ago when I used to advise my patients on phone so that I don't have to go to hospital, honestly speaking.
Okay.
Confession. But what I'm trying to say is that it is advisable that you take fresh consent.
Okay.
Yeah.
Okay, thank you.
There was a question I saw. Do the consultant anytime intentionally harm patient? I am perplexed about this possibility. Maybe yes, I don't know. I totally agree, but that is why I was saying that it is not that onerous, or that is not that easy to make any medical negligence a criminal liability, because there is no mens rea, but there could be some occasions. That is what I've seen. Anything is possible. See, if I was a doctor, I would not have spoken this, but because I'm a lawyer, worst things can happen. Another question is, my question is, during telephonic conversation should be recorded? Yes. However, it is advisable that you inform patient that you are recording the teleconsult, and if patient also has a right to record your teleconsult, but again, he has to inform and take your consent to record. In fact, you can record nothing like it. Next question, when we are taking service of third party, who is responsible for data maintenance? Subject to contract, but I'm sure that data maintenance would be always done by the third party service provider. Whatever agreements I have seen and reviewed, usually the whatever data goes will be managed by the third party service provider. But again, that is the term that is sometimes negotiated depending upon the doctor or depending upon the service provider, who is more powerful or who is a better negotiator. Next question is from Dr. Vijay Balgad. Can we give advice or prescribe on WhatsApp? Yes, under new practice guideline, you can do that, but save it. What are the guidelines? I covered that second opinion. What are the guidelines we should follow? Same thing, I have done it. Voice is gone. Oh, we have people from Gujarat also.
Yeah. Yes, sir. Yes, yes.
Any doctor from Anand? Can you provide consent? I'm done. Cancellation of what are the guidelines we should follow? Done. Bandwidth done. Medical. I suggest next topic, medical ethics and challenges. Very important topic, and very important for doctors also, because I always believe that law is head and ethics is heart, and unless you do balance of head and heart, medical practice will not go. Okay, Kamlesh Nahar, do you foresee a diploma or degree post-graduation course in telemedicine coming up? Yes, definitely it is going to come. In fact, I've been invited. I, in fact, yesterday only gave 2 hours talk on one of the institution in IT institution in Bombay, who have IT and computer application program. So they want to start telemedicine diploma certificate or whatever you call it, and how to go about it. So already institutions are going on, and as I mentioned, under law also, the ministry has notified that all the doctors who practice teleconsult gets trained through a teleconsult program. So NIMHANS has taken that responsibility to start with. But again, the notification says that over a period of time, more and more institutions will come and offer these services of telemedicine training. Contact per I gave. I think broadly things are covered. Yeah. Can you please repeat the approval required for application apps developed for telemedicine? Ajay Balal, is he there?
Ajay Balal is there.
Yes, sir. I'm here.
So I did not understand. So can you please repeat the approval required for application means?
You did mention that the people who are actually developing the application or any device.
Okay. Yeah. So understood. So one, of course, typical IT related approvals would be there. But if this telemedicine platform they are developing is going to be phone based or app based, then there is something called OSP license, which is other service provider license under telecom regulations. So that needs to be applied. It is just an online applications and giving some information and you get it. So OSP, other service provider license from telecom ministry. I realized that I shared my information privately. I'm just making it to everyone. Give me a second. So I've given my 2 numbers and my email ID anytime. If you're WhatsApping, use the first number 98197859884. Second number, I'm slightly sluggish on that. I think almost all questions are covered. Any other questions, please? Could you elaborate more on companies working in telemedicine center? There are, see, okay, well, this is one very important point. What I am expecting and things have started happening, seeing a lot of startups emerging in digital health space. There were many startups who were working on medtech. They also started adding telemedicine as their part. Like Amfine in Bangalore is one. Practo, which was just the access, has started entering into telemedicine space. Librate is there. Mira Doctor is there. Goki may go into telemedicine space. So there are many companies. There is a company called Neurosynaptics, which is very active into developing only telemedicine centers for rural areas or distance areas or remote areas. You send me an email. I'll find out and give you more details. I think we are done.
Thank you, Dr. Antani. That's really very nice of you to spend so much time with us. Dr. Sanjay ji, Dr. Atul ji.
Yes, sir. Thank you.
Thank you, Dr. Milind ji.
Thank you so much.
Sir, as you can see, you have been getting overwhelming response. We, despite we are almost 2 hours and still the questions are coming in. So we thank you. Really, it's a really wonderful.
Saturday advantage.
Thank you.
Yeah, thank you, Milind bhai.
Thank you.
Yeah, thank you.
Thank you so much.
Thank you.
Yes, Dr. Naharji.
Sir. Thank you for the opportunity, and it was very good, very good. Thanks the organizers for this, and happy that TPF is associated with this.
Thank you, sir. Thanks for being the knowledge partner. Dr. Mahendra Bapna, we have a lot of physicians here, and the fact that they felt that it was important to spend so much time. Sir, all the doctors were here. We really thank you on behalf of JITO Professional Forum. Our sincere, heartfelt thanks to you for encouraging us with your active participation, and we hope that some value addition has happened today. So we look forward to your help to help us organize more such events where we can add value, and hopefully TPF as our knowledge partner, sir. Milind ji, you want to say something?
No, I'm fine.
Yes.
Just because people are talking, I did not discontinue.
Okay. No, there was another Milind ji, who's our national secretary.
From bhai. So Nishith Desai company was also knowledge partner when we conducted one session in San Jose. So yes, so we have. It was some 2016.
Okay.
Yeah, Milind bhai, Nishith
we have an office. Actually, we have an office in Palo Alto. So in fact, I was due to come to Palo Alto in April, but because of COVID, I think not coming. But we have an office in Palo Alto in University Avenue, where the Molly Stone store is there, next to that.
Okay. It is very interesting migration. I mean, I was just wondering about you. From medicines to law, it's a completely different structure.
There are some crazy people, so it's okay.
But sir, the value addition that a doctor turned lawyer can do through the doctor's A is the credibility. See, for any doctor to listen to somebody, unless there is a doctor, the respect may not come in.
But I do a lot of transactional work, and myself don't go to court, but a lot of people approach me. Then guidance, what needs to be done, because I have enough transactional work, so don't get time to go to court.
And Akashji, thank you for a wonderful time that we have had flawless tech support.
Thanks, Sanjay. It was a great event. Lots of learning. Thank you for making the part.
Thank you.
Thanks, everyone.
Thank you, everyone, and congratulations to the entire JPF team. You have been rocking all along. Of course, Sanjay bhai had taken a painstakingly efforts in getting this event done, and Ajay bhai and Ravi bhai were always there to support. So wonderful things by JPF, and stay tuned with JPF because lots of things are coming in near future. Yes, thank you.
Thank you, Milind bhai.
Thank you.